And welcome back to Western New York Living. Windsong Radiology Group has taken pride in providing world-class imaging to its patients for over 30 years. In recent years, they've seen a greater need for interventional and vascular services such as pelvic congestion syndrome, migraine headache treatments, uterine fibroid embolization, and many other medical services. I had a chance to meet up with Dr. Dunleavy to take a peek at their newly finished interventional and vascular services suite where all these treatments are being done. If you've ever wondered what's on the wish list for any doctor who focuses on interventional and vascular procedures and treatments, you don't have to look any further than the $1.2 million expansion that they've done at Windsong Interventional and Vascular Services. For Dr. Dunleavy and his staff, they realize it's just another step in providing unmatched medical care in our area.
It's really how can we have the best possible equipment in the region as well as the whole country, and have it in a way that's very easy for patients so they can get in and out, very nice experience, as well as have something that works for every patient. So oftentimes you don't want a situation where I'm too large for that equipment, I can't have my procedure there. So essentially by having the best possible equipment and supplies, we can treat everyone. So we always want the best possible care, and so there's never any shortchanging or cutting corners. And this is something where people around the country ask us, how are we doing this, and why is the experience so great for our patients?
Many of the procedures done at Windsong's new Interventional and Vascular Services suite are focused on women's health. One treatment specifically is uterine fibroid embolization, which, like all other procedures, is performed as an outpatient procedure. Close to 1 in 3 have uterine fibroids, and as I found out from Lorena, it's a medical issue that affects all aspects of life.
I had a lot of abdominal pain, more like cramps, to the point where no amount of medicine over the counter was helping me. And I had come back to the doctors frequently with that issue. I thought it was just part of the cramping until I started getting them more often than once a month. I just would get them pretty much every day. I also couldn't run, and I thought it was because of my IT band or other things. And through the diagnostics that Dr. Dunleavy did, he was able to show me that one of my fibroids was hanging off the back, and that was causing me back issues and prevent me from running or working out.
It's really debilitating for a lot of people, both the pain as well as the bleeding that some people have, and it's something that's just constant. It's always there, and it really affects their family and their work and their life and enjoyment, and there's nothing really that you can do about it once it gets bad enough.
After consulting with Dr. Dunleavy, Lorena was convinced that the uterine fibroid embolization procedure was right for her. It typically takes just under an hour and requires no overnight stay.
So the nice thing about this is it's an outpatient procedure. You essentially can retain your uterus and just treat the problem, which is the fibroids, which is a benign, non-cancerous growth. So they can either cause bleeding or pain related to bulk symptoms pushing on other structures, and we're cutting off the blood supply to the tumor so that it dies, shrinks away. It really is wonderful, going from every access, that we can do this from the wrist and just have people sit right up and walk right out the door is really amazing. We keep people for several hours just to observe them in case they feel like they have any questions or need any medications, but they essentially could get right up off the procedure room and walk right out.
I didn't think it was going to be immediate relief. I'm not even sure if Dr. Dunleavy knew it. His office was checking up on me, making sure that I was not a lot of pain, and it was incredible difference from 100 to a 0. I feel very, very fortunate, at the right place at the right time, and it worked out.
To find out more about all the medical services Dr. Dunleavy and the rest of the staff at Windsong Interventional and Vascular Services are performing, head over to the website at windsonginterventional.com. All the treatments are done in an outpatient setting, and their new $1.2 million Interventional and Vascular Services suite is state-of-the-art. You can give them a call at 929-9484. Now stay right there. Coming up next, we'll be taking a look at some wonderful holiday gifts for a loved one or maybe even yourself when Reed's Jen stops by the studio. Everything from Breitling watches to David Yurman jewelry and so much more.
Special consideration for today's show paid for by the following: